So this is our audience for our communication speeches. Alright, will you look and make sure I'm muted? Okay. I did my informative speech on prematurity, and I've got some things to show you. This is called a Billy Band, and it is used to cover the baby's eyes, similar to sunglasses, to keep them from the bilirubin lights, really bright light, to help their liver process. This is my oldest daughter's first hat, and it fit her. This is her pacifier, and her first diaper, and it was too big. They put it under her and put a cotton ball so they could absorb everything.
All right.
And this is not the smallest blood pressure cuff you can get, but it's the smallest one that I have. So, okay. One of the most joyful things a person has to look forward to in their adult life is becoming a parent. Most women are overflowing with excitement at the thought of the responsibility and anticipation of the body changes. You look forward to buying baby clothes, setting up a nursery, as well as the fun that goes along with picking out baby names. For many women, pregnancy goes along at what seems like a snail's pace for 40 weeks. Then one day you go to the hospital and emerge some days later with a 7-pound bundle of joy. You're a new baby. But for some women, this is not the case. Sometimes a baby is born before the ideal 40-week gestation time. The March of Dimes is a group dedicated to improving the health of babies, and they tell us that 12.8% of more than 500,000 births a year are born prematurely, or before 37 weeks. That is more than 64,000 babies a year. I am the mother of a premature infant. Babies born before 37 weeks, or about 9 months, are considered premature. In 2006, 13.8% of the live births in Arkansas were premature infants. Of that, 2.2% were considered to be very preterm. The sight of a preterm baby can be shocking. Along with the numerous tubes and wires, their skin is very thin and has a rusty appearance. They're really red. They haven't had enough time to develop the fat deposits, so they're flat. Their little bottoms are like pancakes almost. And they're not squishy at all like you would associate with a newborn baby. They're very skinny. My daughter Charlie, she still had her eyes fused. She was that premature. Her eyes weren't even open yet. Premature babies typically have a low birth weight. About 67% of low birth weight babies are premature. Low birth weight is defined as being less than 5 pounds 8 ounces, or 2,500 grams. They also break this down into two different. You've got your moderately low birth weight, which is down to 1,500 grams, about 3 pounds, and then very low birth weight, which is less than 1,500 grams. My daughter weighed 804 grams. She was 1 pound and 12 ounces. She was referred to as a micro preemie, one of the smallest of the small that you can be and still survive. Her head fit, it was about the size of an orange, a small orange. It fit right into the palm of my hand. I had some really good pictures, but she was about 13 inches long, so she was just teeny-tiny. 40% of premature births, they're the cause, they don't know why it happened, but the other 60% can be played up to factors such as infections or inflammations, maternal or fetal stress, bleeding, stretching. My daughter Charlie's premature birth was a result of a severe hypertensive disorder that I had, and premature birth was the only way to cure me. My blood pressure was, at the time that they decided to deliver, it was 209 over 110. And they had tried all the medication they could give me. So they had to pull her on out. There was no indication that I would have a preemie baby. There was no indication of whether it would ever happen again. There's just no way to know. Some women are at higher risk to have a premature baby, and those women are women that have had preemies before, are pregnant with multiples, or have uterine abnormalities. There are several lifestyle factors that could put you at higher risk. Lack of prenatal care, smoking, drinking, drugs, high stress levels, high blood pressure, which is what caused mine, and obesity, as well as some others. After birth, the preemie baby is whisked away to the neonatal intensive care unit, or the NICU. They're weighed and assessed. Because they're often too small for IVs, they run lines into their umbilical stump where the umbilical cord comes out, they snip it off and put lines in so they can give them transfusions and nutrition and stuff like that. In the first couple of days, they'll ultrasound the baby's head to make sure that the brain's not bleeding, which is very common in preemie newborns. And Charlie was sedated, heavily sedated for many months so that she wouldn't burn the calories that she needed to grow. Growth was more important than development. She was closely monitored 24 hours a day, 7 days a week, fed intravenously. She was on a breathing machine for almost 2 months, and most babies spend some time on a breathing machine. And because they cannot make blood at that stage, the mother produces most of their blood for them. When they're pulled out, they have to go through a lot of transfusions. I think Charlie had probably 8 or 9 transfusions in the 3 months that she was in the hospital. And she had to have surgery, heart surgery, at a month old. She was barely 2 pounds, which is what qualified her. And that's another really common. She had a PDA ligation, which is a staple to close a murmur that closes in the 3rd trimester naturally. And that is very common. It was a bedside surgery. It took them about 40 minutes. And they just, I don't know, it just shocks me, the tiny little heart that they were working on, you know. One of the most difficult parts of having a child in this condition is not being able to help your child. Never have I been so vulnerable. At first, I kept my distance. I was scared of everything the child was going through. The tubes, wires, lines, and machines intimidated me. As time passed, I started to understand that my daughter had a fighting chance of survival. She was a feisty baby. She really put it to him. And most of the nurses in the NICU work really hard to try to make you very comfortable with the situation and explaining the machines and the lines and what your baby's going through day to day. The March of Dimes has some recommendations for being comfortable with the idea of having a child in the NICU. They suggest that you should be patient with yourself. It's very common to feel insecure or anxious. And if you're afraid of anything, the mistakes you're going to make, changing tiny diapers, any of that stuff, just tell your baby's nurse. They're trained to help you. Although I wouldn't wish our experience with prematurity on anyone, I wouldn't change what we've gone through. Charlie has a few minor residual issues, developmental, a swallowing problem, but other than that, she's just your normal 3-year-old little girl. And that is thanks to the research that was funded by the March of Dimes and the hardworking doctors and nurses in the NICU, and Charlie is truly a blessing. So that's that one. Should we stop between?
Yeah, we can do it. Stop.
Go right then.
Yeah.